Our last presenter is Giamarqo. His department is the College of Liberal Arts and Social Sciences, Applied Anthropology. The title of his 3MT presentation is Community, Social Network, and Health. G, please take the stage.
I currently live in the city of Fort Worth. My apartment is just south of downtown. It's in an up-and-coming historic area with coffee shops, music venues, and a burgeoning art scene, all within walking distance of my apartment. I love living there. The area is also home to the medical city of Fort Worth, where there are 3 major hospitals and numerous other medical facilities and physicians' offices. When I needed to take my fiance to the hospital last month, it took us maybe 5 minutes to get to the emergency room. The area sounds great, right? Well, an interesting fact about where I live is that those who live there have the lowest life expectancy in the entire state. The average life expectancy of those in my area is 67 years. The state and county average life expectancy, 79 years. Despite living in such a great area, why is it that I and those in the community have such a lower life expectancy? My research is trying to answer this question, and the aim of my research is to apply whatever I find to help develop or aid in the development of programs that improve the health of those in the area as well as in other parts of the city. Looking at all the research on health inequalities, it's extremely complex. There are so many factors that can affect your health, and the experts all disagree on what the major factors are. Well, I thoroughly believe that we are our own experts on our own experience. So I decided to take a bottom-up approach. I talk to people. I talk to those who live and work in the community, those who are embodied by this low life expectancy statistic. There are several findings during my research, but one of the findings that took my eye was this idea of social health resources. When people think of health resources, they usually think of something material, a hospital, a vaccine. Social health resources are really about what one knows and who one knows. 2 issues with social health resources I found really affected those in this area. The first one is that information about local health services was inaccessible, inefficient, and incomplete, creating an issue of what one knows. The other issue was that there did not seem to be a strong sense of community, creating an issue of who one knows. Even if there was one person who knew all about the health resources and services in the area, they could spread that information through the social network and really benefit the entire community through the social network. So how can community and social network be strengthened? That's not a simple task, made further complicated by COVID, our pandemic, and our inability to see each other. So far, I hope to create an accessible online resource system so that people can get information, and to collaborate on a program so that we can create people who become health nodes and social health resource nodes for their communities.